So, somebody of you who would want their impact in a longer run and long term, this is the subject. And when there is a subject, of course, there will be definitions like क्या है exactly, क्या करते हो तुम लोग, क्या exactly क्या चल क्या रहा है, मतलब पता है मेडिसिन में पेशेंट को देखना है, दवाई देनी है, भगा देना है ना. सर्जरी में पता है सर्जन का तो पेशेंट को देखना है, कभी सर्जन देखता भी नहीं है, कभी कभी कोई पेशेंट्स को, आई एम नॉट क्रिटिसाइजिंग एनीबॉडी, बट योर मास्क ऑल द टाइम, यू नेवर नो हु, अरे भाई किसने ऑपरेट किया पता नहीं, कौन था सर्जन पता नहीं, डॉक्टर कैसे दिखता था पता नहीं, you don't know, because they are so busy in their routine schedule, you don't even get to look at their faces, right? So क्या करते हैं पता है, पीडियाट्रिस्ट क्या करता है, so you have a general idea. लेकिन मतलब even if my parents ask me, भाई तू करता क्या, मतलब तू किस चीज का डॉक्टर है, and my friends ask me तू किस चीज का डॉक्टर है, I have to think seriously क्या जवाब दूं. And it has got a flip side as well. One side is a little comic, थोड़ा सा कि क्या जवाब दूं, and the other side is क्या जवाब दूं यार. I am doing so many things, right from the immunization of the child to a palliative care to somebody. Palliative care is basically लोग फाइनल स्टेजेस में मरते रहते हैं, लाइक कैंसर एंड ऑल, और उनका जो केयर होता है, दैट्स सो इट्स सो ह्यूज स्कोप ऑफ दिस पर्टिकुलर ब्रांच. ओके, सो अल्टीमेटली क्या जवाब दूं से, विच वाज in my first year MD, when I took up MD as community medicine, now I have to tell that क्या जवाब दूं, because in last 8 years I have publications in almost every field. Like I have published data in pediatrics, neonates as well, and I have published my data into geriatric field also. So the scope is extremely large. So talking about the same, it deals with the prevention and promotion of the health. Okay, एकदम basic. So खुद के कबर खोदने का धंधा, मतलब क्या, डिसीज प्रिवेंट करो और बाकी का डॉक्टर लोग का धंधा बंद करो. ऑफ कोर्स, isn't it? If I prevent diabetes, prevent one case of MI, जो इंटरवेंशनल कार्डियोलॉजिस्ट है उसका तो 2-3 लाख रुपया का चूना लग गया है ना. So simple. So if I prevent a fall, if I prevent accident, राह चलते, और if I'm promoting the नहीं भाई, you have to wear helmet all the time. हेड इंजुरी का पेशेंट है, you fall from the bike, हेड इंजुरी नहीं हुआ, बच गया. सर्जिकल पॉलीट्रॉमा इमरजेंसी मेडिसिन का एक पेशेंट बच गया. तो बेसिकली अगर तुम इस ब्रांच में आने वाले हो तो तुम तुम्हारे दोस्त लोग की गाली खाने वाले हो कि भाई अरे क्या चल रहा है. No, but still, people are still going to be stupid. People still will commit all the mistakes they want. People still drink and drive and crash their bikes and cars into the, haywire accidents. तो धंधा तो चलने वाला है, धंधा मंदा नहीं होने वाला है. Okay. So then there's a preventive. So earlier this particular branch was called as preventive medicine, and now it is called as social medicine. Preventive and social medicine. Now it is called as community medicine. So it was only preventive, कि भाई डिसीज नहीं होने देना. सोशल मतलब भाई अगर कोई डिसीज हुआ है तो उसके साथ क्या होता है, लाइक व्हाट आर देयर, अगर HIV हो गया तो व्हाट इज देयर सोशल डिटर्मिनेंट्स, एंड if somebody has a child has a malnutrition, what is its social determinants. So that social concept, that is social medicine. Then community medicine, so evolve हो रहा है. जैसे बंदर से आदमी बन गया ना, वैसे definitions भी हमेशा evolve होते हैं. So evolving. And then it talks about promotion of health community. तो लेकिन सबका साथ सबका विकास करेंगे भाई, तो सबको लेके साथ चलेंगे. मतलब क्या कि आशा वर्कर्स को भी एम्प्लॉय करेंगे, you'll peers भी खड़े करेंगे, and there'll be some community leaders also who will be contributing to the health and all. So ऐसा सब कुछ करेंगे, सब साथ मिलके we will empower the community. Okay. And उनका फिर then comes public health. So similarly, सब कुछ सेम काम करना है, लेकिन गवर्नमेंट का अंडर द अम्ब्रेला ऑफ गवर्नमेंट. मतलब पता है ना तुमको कि भाई लोगों को गवर्नमेंट स्कूल नहीं चाहिए, गवर्नमेंट हॉस्पिटल नहीं चाहिए, लेकिन गवर्नमेंट जॉब हाँ सबको चाहिए. बस बैठ के पैसा आ रहा है, योर अकाउंट गेट्स सैलरीड एवरी मंथ, मस्त आराम की लाइफ. ऐसा नहीं है, ऐसा नहीं होता, बट दैट्स व्हाट पीपल थिंक एट द आउटसाइड. सो पब्लिक हेल्थ, सो गवर्नमेंट्स responsibility into catering services to the public health, isn't it? So right from the primary health to secondary, to tertiary. Like primary health matlab very simple, jo tum whenever you go to a cinema theater and you watch an ad, तंबाकू से कर्करोग होता है, ये सब जो ad है primary health. तंबाकू मत खाओ, that's what. So that's primary health actually. That's an health department job. Right from that to disability prevention and giving cycles to the disabled individuals. So that's all is aspect of public health. In fact, nowadays you must have seen that the buses have a specially enabled ramp on which the wheelchairs can be pushed up. So all these things are coming up. That's what called as Able Bharat या फिर Sabal Bharat योजना, जहाँ पे you empower the disabled people also. So ऐसा सब कुछ, all this is there and it's got a huge scope, and that's why there are so many things to do, right? Out of that, one thing is community health center. Okay, community health center. So community health, देखा क्या है community health, community medicine, but there is a center wherein these services are provided. Okay, and that's called as community health center, and we'll saw that. So ultimately what I want to tell you all is what happens out of these so many services. Community health services center पे क्या होता है? Community health service center कहाँ पे होता है? So there is an hierarchy. Everything has an hierarchy? No. You must have learned in your civil sciences classes. क्या होता है? Right? There is a village. Village के बाद क्या होता है? तालुका. Right? Block. Maybe South Delhi, South Bombay वाले लोग block. Okay? And then block के ऊपर क्या होता है? District. District के ऊपर क्या होता है? Region. There's a region, like, some of you are from Marathwada, some of you from Vidarbha, some of you from Konkan. If you are Gujarati, some of you from Saurashtra, if you are from Northeast, Meghalaya, Northeast, North Khasi, East Khasi, West Khasi, so regions. 3-4 district ka cluster is a region. And then it goes to state and then national. Similarly, health services are also provided at a corresponding level. So village mein, there is something called as sub-center. Sub-center. Nowadays, it's called as health and wellness clinic. But sub-center. Then at a big village level, there are smaller villages, right? And there are some big villages. So at the big village center, there is something called as PHC. So people who are from rural background, there are quite a few villages, and there's a big village, जिथे आठवडी बाजार भरला जातो. Anybody? Weekly, क्या बोलेंगे, farmers market again for South Bombay and South Delhi people. Weekly farmers market. काही नाही, बाजार असतो, लोक येतात, भाज्या खरेदी करून घरी जातात. That's it. So weekly farmers market. So that place is, you have a PHC, primary health center, because there are so many people coming from different villages on that. That's a draining village. So PHC. And then at taluka/block level, you have a community health center. Okay. So whatever happens at that block level, we are going to see that. Just a second. Yeah. So community health center. It can be as beautiful as this. Okay. Ye Katra ka hai, to obviously it will be anybody knows? Anybody has been to Katra? Very good. Vaishno Devi ka junction, yeah, entrance to Vaishno Devi's Katra basically. So it can look as beautiful as this, or maybe there are quite a few worse images which I don't want to portray. Sorry. But acha rehta hai, no? So basically people come from taluka, all the people who are residing in that taluka and / block are supposed to avail the services at this particular center. So yahan pe kya kya hota hai, this is what I'm going to tell you. I have made it, try to make it a little funnier for you all to learn, because trust me, फर्स्ट ईयर MBBS में यहाँ पे क्या क्या होता है ये जानने वाले, मतलब अंदर से जानकारी लेने की जो इच्छा है, I don't know how many of you really have, but if I would have been in first year, I would have been least interested to know all these things. So I've just made it into a little funnier way, and I'm going to relate to a movie. Everybody likes movies? अच्छा, raise the hands who doesn't like movie. मूवी देखना अच्छा नहीं लगता, क्या बकवास टाइम पास. अच्छा, मूवी थिएटर में जाके सोते कौन है? वेरी गुड, यू आर अ पीस स्लीपर्स, मतलब वेरी गुड, वेरी गुड, नाइस. मैं ट्रांसफॉर्मर्स में सोया हूं, कैन यू इमेजिन? ट्रांसफॉर्मर्स, सो लाउड मूवी, एंड आई वाज डोज्ड ऑफ. एनीवेज, ओके, सो हॉस्पिटल है तो बंदे लगेंगे, नो, यू नीड मैन पावर. तो कौन कौन लोग होता है? So जनरल सर्जन, फिजिशियन, OBGY, पीडियाट्रिशियन, एनेस्थेसिस्ट, बेसिक जो भी फैसिलिटीज है. यू आर नॉट गोइंग टू सी अ कार्डियोलॉजिस्ट एट कम्युनिटी हेल्थ सेंटर, या रूमेटोलॉजिस्ट, या पीडियाट्रिक ऑन्कोलॉजिस्ट, ऑन्कोलॉजिस्ट, ऐसा कुछ नहीं रहता है उधर. भाई सादे सुधे डॉक्टर रहते हैं, आगे तो आगे, नहीं आए तो नहीं आए. डॉक्टर कहाँ है? आ रहे. कहाँ रहते हैं? इधर बाजू में. डॉक्टर रहता है डिस्ट्रिक्ट प्लेस पे, तो वो आ ही रहा है. पेशेंट बैठा है, कब आ रहा है? हाँ आ रहा है, वैसा. तो आराम से इधर काम चलते रहता है ना. Nowadays it is uplifted. I'm talking about what used to happen maybe 10 years back. Nowadays the things are quite improved. Yeah, so basic services, good doctors, qualified ones to be service providing. Okay. Then public health manager नाम का एक चीज होता है, so that everything puts up into. So basically जैसे ऑर्केस्ट्रा होता है, एंड देन इन दैट ऑर्केस्ट्रा यू हैव अ म्यूजिक डायरेक्टर जो हाथ हिलाते रहता है. पता नहीं वो हाथ क्या हिलाता है, वो किसको क्या पता है? सीरियसली, मतलब क्या है वो? कैन एनीबडी हैज एवर ट्राई टू डिकोड दोज मूवमेंट्स? एनी म्यूजिक लवर्स हियर? नहीं, नॉट दैट लवर्स, मैं भी लवर ही हूं, लेकिन क्या करते क्या है वो? तो उस टाइप का. अच्छा, क्या करता है वो? ओके ओके, okay, great, great, clap. Your name please? Vedant. So Vedant has deciphered it for us, and it exactly goes with this. I knew it कि कोई तो रहेगा भाई जो मेरे को हेल्प करने आएगा. That's what exactly public health manager does. Because सर्जन बोलेगा नहीं काटेंगे, मेडिसिन वाले बोलेंगे नहीं भाई रुक, दवा देते 3 महीने के बाद आ जाओ. तो what exactly is to be done? So that orchestrating all the things together is the role of public health manager. 10 दिमाग अलग अलग साइड में चलते हैं. Too many cooks spoil the curry. Have you heard this? तो इसलिए बेटर है कि भाई सबको एक साथ बांध के चलते हैं. So that what eye surgeon है, dentist surgeon है, so many things are there, and there's somebody who is specialist in Ayush as well. And then you have non-medical or paramedical staff, PHN and nurses, lab technician. You need a radiologist, you need ophthalmic technician, dresser, ward boy, sweeper, chowkidar, blah 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 blah. So many things are there. By the way, this is a question which can be asked. पूरा list, सबका कुंडली बताओ CHC में कौन कौन रहता है. Okay, some of these things are as careers to many other people. You might not have heard of it. कि भाई there is something called as ophthalmic assistant. Who knew कि there is an ophthalmic assistant? तुमको पता था कि ऑफ्थेल्मिक असिस्टेंट करके भी कुछ चीज होता है? बाय द वे इनके एडमिशन CET में से ही होते हैं. यस, एनीवेज, सो इतने सारे लोग हैं जो पूरा वो CHC चलाते हैं, एंड दैट CHC हैज अ स्ट्रक्चर टू बी फॉलोड बाय. ओके, तो जो PHC है, CHC है, डिस्ट्रिक्ट हॉस्पिटल्स है, दे हैव टू अबाइड टू सम रूल्स. ओके, ऐसे ही नहीं कि भाई मेरा सीएचसी मेरे हिसाब से बना लिया, लाइक यू नो, लाइक नहीं मुझे 2 जनरल सर्जन चाहिए, ऐसे नहीं होता है. इट इज अ फिक्स्ड मैन पावर and it has got a fixed structure. Okay, that's called as branding. So most of the CHCs inside, from inside, बाहर से कुछ भी काला पीला नीला हरा हो सकता है, लेकिन अंदर से they will have the same type of rooms. Okay, and that is decided by something called as IPHS. Okay, IPS नहीं, IPHS, Indian Public Health Standards. So it has got a standard, जो standard के हिसाब से उधर सब कुछ वैसे का वैसे चलना चाहिए, तो सबके लिए it should look same. So it's a team. You know, it's not a single person managing everything. It's a huge team who does the task of delivering the services. Understood? अभी कौन-कौन से services? So various services, 14 services are there, and we'll try to learn these services one by one. So just the difference to tell you कौन से लेवल पे क्या होता है और कितना पॉपुलेशन उधर आता है, और उधर रूरल एरिया कवर्ड कितना होता है, रेडियस कवर्ड कितना होता है, नो ऑल दिस थिंग्स. सो व्हाट वी आर गोइंग टू टॉक अबाउट इज दिस, या सेकेंडरी लेवल फॉर 1 लाख to 1.5 lakh 1 lakh से 1.5 lakh population. Okay, 30 medical staff. It's manned by the central government, and that much the area it's covered, and radial distance covered, and average number of villages are covered. Okay, this is what is the difference in. Has anybody been to community health center in their district? So, कोई नहीं गया? कोणी नाही आहे? जळगाव मध्ये पाचोरा? Nobody is from Maharashtra area, or maybe other than Mumbai or other than Pune. Yeah, raise your hands. हा, कुठचा आहेस तू? नंदुरबार. कोणता तालुका? की प्रॉपर नंदुरबार? शहादाचं हॉस्पिटल पाहिलंय? गवर्नमेंट हॉस्पिटल नाही पाहिलं, गरजच नहीं, जाने का जरूरत ही नहीं है उधर. भाई गवर्नमेंट हॉस्पिटल नहीं जाऊंगा, लेकिन गवर्नमेंट मेडिकल कॉलेज में जाऊंगा. So that's what our aim is. मेरे ऐसा नहीं है, मैं भी कुछ दूध अधूरा नहीं, मेरे बच्चे भी प्राइवेट स्कूल में ही पढ़ते हैं, ऐसा नहीं कि मेरे बच्चे गवर्नमेंट स्कूल में पढ़ रहे हैं. But why? So that is the mentality. We do not go there, you know, and we think that नहीं, ये तो गरीब लोगों के लिए, अपने लिए नहीं. अपने लिए तो डॉक्टर जैन्स हॉस्पिटल उधर मैं जाऊंगा, अपोलो हॉस्पिटल उधर मैं जाऊंगा, isn't it? So this is how these things are placed at, and we don't know about these things. You know, we don't know where these community health centers are placed. So whenever people, even if so this is an appeal to all of you all. So suppose if you go to your own hometowns, and the people who are staying at taluka places, visit your taluka places, and some of you who will go for recreation to rural areas, या फिर ट्रिप निकाल लिया, या फिर कहाँ सिक्किम घूमने चले गए, या फिर मेघालय घूमने चले गए, या शिलोंग घूमने चले गए, लद्दाख घूमने चले गए, तो वहां का CHC एक बार just try to visit. Okay, take half an hour out of your itinerary and then go there. Okay, fine. So the services which are delivered, so these 3 things: PHC, community health center, and CHC, sub-center in Andhra are called as health ATM. Telangana, sorry, not Andhra. Yeah, so these are the different services delivered. What are the different services delivered? First is emergency. That I'm going to take you through these referral services through a movie. The name of the movie is, can somebody identify? Very good. So name of the movie is 3 Idiots, and we're just going to try and relate the scenes from 3 Idiots, how the CHC services are provided. Okay, some of the services covering के लिए मूवी में सीन नहीं बनाए थे, वो उसका गलती है, मूवी वाले का गलती है, मेरा गलती नहीं है. तो लेकिन we'll try to cover how. So care of routine and emergency cases in surgical. यहाँ पे क्या हुआ है? What has happened in this scene? कूद दिया, भाई कूद दिया। तो भाई ने क्या किया, एकदम फुल सब बत्ती लेके उधर से जो कूद गए भाई, और ये भाग रहे इमरजेंसी सर्विसेज लेके। एंड हाउ फनी दिस सीन इज, इफ यू यू आर अ मेडिकल स्टूडेंट एंड यू आर रिएक्टिंग टू दिस सीन, क्या करते, कर क्या रहा है ये, मतलब ही इज जस्ट वो एम्बुलेंस वाला सीन जहाँ पे आमिर खान ने अरे सर को बाजू में सर को, एंड द एम्बुलेंस इज पासिंग फ्रॉम बिहाइंड, एंड देन दिस स्टूपिड इमरजेंसी, दिस इज नॉट हाउ इट इज डन देयर। So basically emergency services, as far as the OPD is considered, as far as the incision and drainage is considered, okay, ऐसा emergency नहीं होता है CHC में, it's for the basic purposes, okay, emergency surgical services. So road traffic accidents which are minor, which does not involve the highly trained orthopedic surgeons and all, compound fractures वगैरह ऐसा सब treat नहीं होगा, basic things can be treated, otherwise the patient will be referred to the tertiary hospital. So common injuries and emergencies like surgical emergencies like appendix का issue है, somebody has got a pain in abdomen, cholecystectomy, acute cholecystectomy का incidence, basic services can be done here. Okay, so not highly complicated emergency services will not be done. Okay, so emergency care for emergency medical services, surgical care. This is medical care. भाई स्कूटी लेके पहुंच गए डायरेक्ट आईसीयू में, nonsense. Again, no, this is not something which is being done there and anywhere. But so routine emergency services like dengue, CCF, cough cold fever services, minor respiratory ailments, MI treat नहीं होगा, stroke treat नहीं होगा, got it? So very basic medical emergencies will be treated. Maybe mild poisoning can be treated. At some places, mild cases of snake bites can be treated. Scorpion bites, mild cases can be treated. Okay, these are the medical emergencies which are not so severe, can be treated at taluka level. Okay, so imagine a small block with a small hospital. That's how you are going to treat the cases there. Okay, so basic poisoning cases. Okay, so this is about medical. So cough cold fever. Cough cold fever. So basic cough cold fever, basic asthma. Not like status asthmaticus cases where the patient is going to need heavily equipped ICU, no, that is not going to be done here.
All is well.
So, maternal health checkup, not like this. भाई हाथ लगा और बोलो all is well और kick मार दिया, नहीं भाई, ये सब नहीं होता है. Okay, please take these things out of your mind if you are thinking कि यहाँ पे ANC checkup, KM का ANC checkup ऐसा होता है. No, that's not done. So basic ANC checkup, when ANC will come to your clinic, the ANC is introduced. So ANC checkup is a routine thing. Okay, the ANC is antenatal care. Antenatal care मतलब pregnant mother का care. Okay, right from there's something called as UPT stick. Okay, so ये ऐड आता है ना कि urine pregnancy kit. So urine pregnancy kit is UPT or urine pregnancy test. So you have to put drops of urine on it and it will show the control and all. So detection of pregnancy. Then ANC checkup. So ANC is basically mother who is pregnant. So pregnant mother checkup when she will come to the hospital and take her height, take her weight, BP, sugar, hemoglobin, all these things are there. Unka ultrasound will be done. Nutrition advice will be given. And then PNC is postnatal care. Okay, so when the mother is delivered normally, even if she's delivered LSCS, then asking her to come to the hospital, delivering the care in the sense, advice regarding the breastfeeding, how to do that, and care of the wound if at all it's LSCS. LSCS is basically lower section cesarean section. Okay, lower segment cesarean section. So cesarean basically. So basically baby jab cesarean delivery hota hai, so there's a wound there. So wound care will be provided. So basic services will be provided there. And JSY is basically Janani Suraksha Yojana, and JSSK is Janani Shishu Suraksha Karyakram. So these are the government programs by which the hospital delivery is promoted. Because पहले क्या होता था, घर पे ही दाई माँ आती थी, दाई माँ, have you heard this in movies? दाई माँ आ गई बच्चा, आपको बेटा हुआ है, फिर राजा जैसे निकाल के ले लो, माला ले लो. ऐसा नहीं, हॉस्पिटल में जाके आजकल माला वाला कुछ नहीं मिलता, फटके मिलता है उल्टा बच्चा मरने के बाद. That's sad part of it. So yeah, so that care is something which can be provided at this particular level. Okay, so maternal health. So हमने क्या देखा पहले? सर्जरी हो गया कवर, मेडिसिन हो गया कवर, OBGY कवर हो गया.
तो क्लिप लगाओ, एम्बिकल कॉर्ड काटो. क्लिप लगा दी, अमेरिकन कॉर्ड में लगा था. ये चला क्या जी?
Allow you to sink into that. So newborn care, यहाँ पे baby is delivered and the rancho is taking him out or her out, and I don't know क्या हो गया भाई.
तो क्लिप लगाओ, एम्बिकल कॉर्ड काटो. क्लिप लगा दी, अमेरिकन कॉर्ड में लगा था. ये चला क्या जी?
Yeah, so basically इस scene के बाद the doctor tells कि उसको बोलो कि cut करो, and they actually have a cut and cord care. So basically in this there is a 5C, clean surface, clean cord, clean cut, clean hands, and clean towel. Okay, so clean clips. So these are 5 C's which has to be observed while the delivery is done, while delivering the baby. So that's again is depicted in the movie, how they cut the cord and they get a clean towel and the towel is pushed beneath the baby. So all this is given at newborn care. So it's a part of a newborn care. Okay, all these 5 C's, and as well as rubbing the baby on the back if the baby is not, vagal stimulation basically. When the baby is not breathing, then ABC of the baby, when the baby is not breathing, put the air into the baby's mouth, that way, turn the baby upside down so that the baby's whatever secretions are there stuck inside the throat, they can be moved downwards fashion. So this is newborn care which is provided, and that is depicted. So now 4 things are done. Surgery, medicine ho gaya, surgery ho gaya, OBGY ho gaya, and pediatrics ho gaya. So these basic services are there. Then the services regarding family planning. There was no scene of family planning in that particular movie. Censored wala scene bhi nahi tha. Aisa mat dekho. Censored bhi nahi tha, non-censored bhi nahi tha. So it is basically to provide the services which are essential at that particular level. So family planning services, counseling of the couples regarding family planning, the methods of contraception, okay, physical barriers of contraception, and the hormonal methods of contraception, basically condoms or Mala D, Mala N, ye sub pills. You must have heard of these pills, right? And there's an Antara, which is intrauterine device. Copper T naam ka tumne aapne suna. So these are all the family planning services which are provided. Not just ऐसा नहीं कि भाई आ गया बिठाया condom दिया 5 चल भाग, ऐसा नहीं. उधर बिठा के उनको counsel कर सकते हैं, like how you can plan your kids, when to plan, how to plan, what should be the difference between the 2 kids, all this to be counseled, which is done. It's not what I'm telling you in a theoretical manner, it's actually done. And then safe abortion services and MTP services. So MTP is medical termination of pregnancy. Okay, so medical termination of pregnancy by giving the pills, that is by tablets or by DNCY in surgical way. So whichever way it is possible is to be provided at family planning. Yeah, then there are different national health programs, bade naam, NVBDCP, national program for RNTCP is nowadays called as NTEP, National Tuberculosis Elimination Program. See, we used to call it as a National Tuberculosis Control Program. Now it is called as National Tuberculosis Elimination Program. So we are on the verge of elimination. Control is just control. Elimination मतलब लात मार के बाहर निकालने का. Okay? तो elimination के तरफ. NVBDCP is National Vector-Borne Disease Control Program. So vector-borne diseases which are लिखे वहाँ पे. अरे यार, गूगल नहीं डाल पाया. So vector-borne diseases, mosquitoes की वजह से जो diseases होते हैं. And other than mosquito also there are quite a few diseases. HIV control program, leprosy elimination program, eye diseases, IDS. So various programs, at least 25-30 programs run at that center. So execution of those programs comes under the CHC. Yeah, physical medicine and rehabilitation. Important. So not only post-accidental care, बस accident होने के, जिंदगी के साथ भी, जिंदगी के बाद भी, उस टाइप को लोगों तो एक्सीडेंट के साथ भी जब तुमने देखा while emergency services were provided, but post accident care, wheelchair, crutches, providing wheelchair to the patients, crutches to the patients, enable them to work at so physiotherapy services will be provided at that particular center. And if at all there are people who absolutely need vocational rehabilitation, that means somebody who I'll give you a very simple example. Somebody who doesn't have 2 feet, okay, and he met with an accident and he lost his feet or one of the foot. So, and he was a tailor by an occupation. Tailor is designer, kapde silne wala. Yeah. So, just out of the context, why sartorius is called as sartorius? There's a muscle. Sir? Anatomy is alazun. Okay. Again. So find this out. Sartorius. Sartorius is a muscle in your thigh, and it is called as sartorius because Greek sartorial is a word for tailor. Okay, so that's why. And purane zamane mein the tailoring machine used to be put on the lap, and then the tailoring used to be done. So that's why. Okay, forget about it. So foot. So somebody who is a tailor by occupation lost his foot. And now tailoring machine, have you seen those tailoring machine? It has got pedals और फिर ऐसा घुमाना पड़ता है. So now वो कैसे कमाएगा? How would he earn his daily livelihood? So then the training will be given how he can do it with the hands, and the machine, the hand operated tailoring machine will be provided. So that's a vocational rehabilitation which also supposedly to be done at physical medicine. So there is some essential and there are some desirable. Okay, essential is primary prevention of disability. Okay, so somebody who's had an accident, to not allow him to get disabled, मतलब उसको accident हो गया तो घर पे बैठ के नहीं रहना है. He will earn his livelihood on his own. So that is disability prevention. Okay, and desirable is exercise. So basically, whatever services which can be provided, exercise or physiotherapy services can be provided on a weekly basis also. Not that you have to have that person daily on board, but this can be weekly basis. जितने भी disabled लोग हैं or whosoever needs the physiotherapy care can be, called on one day, and then the services can be rendered.
Nothing is impossible.
Oral health. Yeah. So dental care and health education. Health education of the oral health is also important. Okay, not just that detection of a plaque or something called as leukoplakia, the white patch inside the mouth. The people who are smokers or people who are tobacco chewers, they have this bad dental hygiene, as well as they can develop cancer, oral cancer, right? But before they develop an oral cancer, there's a stage where there is a patch which is seen developing. Usually at the place where they keep that small goli, जो ऐसा गोली बना के ऐसा करके करता है ना, तो वो वाला वो वहाँ पे रखता है. So because of that continuous irritation, they go into that patch, fibrotic patch around that typical area, and that can be detected early. If that is detected early, then the patient can be counseled accordingly कि भाई already तुम कैंसर के जाल में फंसने वाले हो, अब तक अगर तुमने तंबाकू खाना बंद नहीं किया तो सीधा भगवान के घर या नरक जिधर भी तुमको जाना है उधर जा सकते हो. So go to hell. ऐसा नहीं, आराम से. तो ऐसा, so this is the primary prevention. You have to prevent it. right? And there are stages like submucosal fibrosis, like, when you ask, open the mouth, and it has to be at least 3 to 4 finger breadths, so mouth opening has to be that much. But ये गुटखा खाने वाले लोग, उनका मुंह तो खुलता ही नहीं है. अगर तुम्हारे कोई friends है, फिर relatives है, you ask them to open their mouth, they'll be like, खत्म, मुंह नहीं खुलेगा. Submucosal fibrosis, because submucous there are muscles, and ultimately these muscles go into fibrosis. That's why they can't open their mouth fully. So that submucosal fibrosis will be developed for smokers as well as tobacco. So this has to be detected as early as possible, so that patient doesn't end up having the cancer and succumbing to that. Yeah, so school health services. This is an actual picture of the school of Funsuk Wangdu, okay, which is in Ladakh. So school health services also to be provided. What is school health services? What these guys do, doctors who are placed at CHC, they go to the schools and do checkups for children. Okay, so the aim of the school health services is to detect the cases of all the possible diseases which can be prevented. Like for example, the diseases which are really common is hemophilia, sickle cell anemia. Have you heard of these diseases? Blood diseases of the child, so that पता चला anemia है, फटाक से anemia वाले बच्चे को उसका blood ले लिया. So you just do the screening first, and you pick up the children which are going into that disease area. So somebody who is suffering from anemia, take his blood, analyze and see whether they have. So basically screening, detection. Okay, somebody who uska auscultate karo. If you hear a murmur, it could be RHD, rheumatic heart disease. Chalo, hospital chalo. So all the screening of the important diseases which are quite prevalent and which are preventable. The mortality is preventable, can be screened and referred to CHC, and from the CHC if the patient needs, अभी बस RHD detect किया या valvular heart disease detect किया, उधर उसका operation होने वाला है क्या CHC में? नहीं, they can be referred here at a tertiary care center. So school health services, that's what the school health service guys does. Counseling, adolescent health. Remember the scene from this movie? ये बच्चा क्या करता है बाद में? मिलीमीटर से सेंटीमीटर बन के लद्दाख पहुंच जाता है स्कूल में. वो उसका तो इधर बस चाय बेचता रहता है. He is managing the entire school. So understand, Rancho did the counseling, adolescent counseling for this guy, and that's why he's there. So there's adolescent counseling, because the children, adolescent children, you are also an adolescent by the way, by definition, need care, needs attention. Sometimes they are getting engulfed by the precarious habits like tobacco, alcohol and other drugs, getting engulfed. So needs counseling, needs proper counseling, है ना. यहाँ पे कुछ career counseling नहीं होने वाला है कि भाई तुमको आगे जाके MBBS के कौन सा सीट मिलने वाला है, वो वाला counseling नहीं, ये वाला counseling. Okay. And referral services for voluntary testing centers and postpartum testing centers and all this. Blood storage facility, again, I don't have an image which relates in 3 idiots to blood service facilities. So blood storage facilities basically transfusion के लिए whatever facilities you need, screening of the blood, storage of that blood whenever, suppose a patient who is an obstetric patient and suffered from postpartum hemorrhage. Okay, there's something called as postpartum hemorrhage. Matlab after baby is delivered, blood never stops because the uterus is already there into hypotonia and the blood vessels is already broken. Blood doesn't stop at all. So patient might need transfusion. Right? In that cases, blood storage facilities need to be Clips are not getting fully played. Anyways, so diagnostic facilities, as you might have seen in the movie, but all the basic diagnostic facilities like X-ray, lab facilities and ECG should be available at that. And these services should be provided. Transport services, okay. Somebody who is getting immediately, doesn't have enough services which can be provided at CHC. Like again, in case of an accident, जहाँ पे patient was there, was in good health, you actually recovered that patient, but patient went into sepsis. Sepsis is basically terminal infection, heavy infection. So patient sepsis में चला गया तो उसको transfer करना पड़ेगा, right? Patient might need a ventilator. So that transport from CHC to higher centers. CHC का higher center क्या होगा? From taluka, district hospital. Okay, so transport is done also.
Please push करो.
If the mother is dying or dead, maternal death is done. So maternal death is basically any death of the mother within 42 days of the delivery, which can directly attributed to the pregnancy. So maternal death matlab aisa nahi ki mother is there, she was there and you discharge her and she went out and suddenly she meets with an accident and dies. That's not a maternal death, even if it takes place within 42 days. The cause has to be related to pregnancy. Okay, so that's maternal. And that maternal death needs to be reviewed. Every maternal death, trust me, every maternal death is deeply reviewed. What went exactly wrong? Why this mother has died? Because we really want to, these are the indicators. Okay, maternal death, infant mortality, maternal mortality, these are indicators, these are the face of your nation. You might not be really aware of this thing, but on an international circuit, these figures matter. And these are the figures which actually will tell you that how progress and how developed your country is. Right? There was an index which just had come. And India fell down on that index drastically. And we are actually below Pakistan also. And then it was all talked about. I forgot that name of that thing. But these are the indices which really matter on international circuit. And that's why these things, so that's why even a smaller incidence and even a small maternal death is to be accounted and goes in depth. Okay, so most of these things, 14 services are there. Okay. Ops, right from medicine, surgery, OBGY, pediatric, family planning, adolescent health, right? Family services, school health of the children, blood facilities, referral facilities, all these services are provided. Not very high end, not very basic also, something which is there in the middle. Yeah. So taking an image of community health center, a good image of a community health center in your minds, because I don't want to imagine this. Visit your community health center wherever there is. Thank you so much.